thank you all for being here. It's incredible to see this many people on what's turning into a beautiful day, and I really do appreciate it. So let me go ahead and introduce our panelists. And to my immediate left is Liz Oram-Bedell, who is the immediate past president of the Oregon Scleroderma Foundation. And this is an interesting note. Everyone sitting up here right now are patients living with an autoimmune condition. I'm living with HIV. Liz is living with scleroderma. Next to her is Tammy Stackhouse, who is the certified health coach and co-leader of the Fibromyalgia MECFS Support Center Incorporated. Got that right? And a fibromyalgia patient. And Anita Noble, who is a board member with Molly's Fund, and incredible, and I urge all of you to read these incredible women's biographies, and is also a lupus patient. So thank you all for being here. I'm going to ask everyone to take about 5 minutes and talk a little bit about the issues that are most important to them as patients, to how they manage living with autoimmune conditions, what works for them. And then I'm going to speak to some of the policy issues around healthcare policy, insurance, and some of the changes that we've seen. You also have note cards out there, and if you have a note card and you have a question that you want to ask, just finish your card and one of us will collect it, and thank you again. So Liz, let's start with you. So tell us a little bit about some of the challenges that you have as a patient and the work that you do.
All right. I for the last more than 15 years have been the president of the Scleroderma Foundation Oregon chapter, and we are associated with the National Scleroderma Foundation based in the Boston, Massachusetts area. And I would like to say that we have the new president, Denise Basin, and the new vice president, Maria Ravelli, here as well. Maria lives with scleroderma, as do I, and Denise's husband lives with scleroderma, and we all have different challenges. Denise's husband has had to have a double lung transplant, an enormous challenge. Maria has had many ulcers and problems with her hands, has had to have some of her fingers removed. I live in a different world. I had started out in a lot of pain, and over the 21 years that I've been a patient, it has diminished, and nobody can tell us why. Nobody can tell us why this, or why this, why each one of us is so different. And I think like lupus, we do have that unique thing that we all have different symptoms, so it is hard to diagnose. There are many medications that could be used for different symptoms. They don't have anything that is a cure, of course. They don't have anything that is a one-stop fix just because you have SD. So there are many, many challenges in finding what is right for each person because each person lives with a different set of challenges. I started out with bands of red, hard, rubbery skin across my body, up all my limbs, and it was almost immediate. When that started to go away, and my fingers were extremely swollen. They were like big fat sausages that could not be bent. I could not pick up a fork. I could not pick up a knife. Over the years, that pain has diminished. The bands of hardening skin, and scleroderma does mean hard skin, which also affects the connective tissue around our organs and other parts of our body. When all of that swelling and those came down, the fingers started to curl. So I have lost some motion in my fingers, but I don't have the pain. Nobody can explain why this happens, but it happens to some scleroderma people.
Can I ask?
Yes.
Do we know how many patients are impacted or living with scleroderma, either nationally or here in Oregon?
Then all the national numbers in the couple of different foundations kind of say about 300,000 patients for scleroderma. My opinion is it's probably more, because of the similarities between some of the lupus and other autoimmune diseases. I think sometimes we get misdiagnosed. Doctors not always sure which one they're looking at, and I think more and more doctors are learning about scleroderma, where 20 years ago when I was diagnosed, really it was hard to find doctors that really knew about scleroderma. They might have heard about it, but not really seen patients with it. They may not have treated it, so they weren't sure what to do. There wasn't a lot of research going on then. There is increased research, not specifically for scleroderma so much as autoimmune. We're under that family, but we know that usually hits midlife. Not 100%. We do have youths with it. We do have young women with it. But we do know that 4 out of 5 will be women. I'll have to say in our chapter we have seen an increase in men with scleroderma. So we know the statistics, but I'm not always sure they're that accurate.
And what about treatment? What type of treatments are available?
Again, it depends. There are so many different symptoms. One of the things that kind of brings us together is digestive problems. So of course there's things like the Prilosec and medications on that order. There are some of them have to be on methotrexate or different kinds of cocktails like that. It depends on what it is that you are, what the challenges are that you're living with. And so I really don't speak much to the medications, unfortunately, because
it's as unique as the
as
symptoms of
unique
the
as each
disease.
person.
Yeah.
Mm-hmm.
Well, thank you very much, and thank
Thank
you
you.
for helping all of us become more aware of this and the condition. Our next panelist is Tammy Stackhouse, and I first met Tammy when we were working on the Health Evidence Review Commission, which is a very wonky policy board that basically sets the procedures and medications for all patients who use Medicaid in the state of Oregon. And she was there advocating on behalf of fibromyalgia patients. So, Tammy, can you tell us a little bit about the same questions, I guess, yourself, your work, and how fibromyalgia impacts Oregonians?
Sure. So I was one of those kids who was never really well. My parents always said that they took my sister to the doctor for repair and me just for maintenance. So I was one of those kids. And so I suspected that there was something going on for quite a long time. And like most fibromyalgia patients, I saw quite a few doctors, and it took many years before I finally got a diagnosis. I was diagnosed in 2007, and in 2008, I decided to file for Social Security disability. I was at a point where I really felt like I couldn't take care of myself, I couldn't take care of my house, and maybe that's what disability was all about. So I filed in 2008. And then in 2009, I really started working with my doctor on finding out what all was going on underneath my fibromyalgia. And that was a real turning point for me. We found out that I have Hashimoto's thyroiditis, which is also an autoimmune condition. For those of you who don't know, basically your body thinks your thyroid is evil and tries to kill it. So I have that. We discovered a bunch of things and started treating them. And so by the time I got in front of a judge for my disability claim, I was well enough. That's the good news and the bad news. I was well enough, I didn't qualify. And from that experience, I decided that I wanted to help more people go through what I went through and do it successfully. So I decided to become a coach. And I work with women with fibromyalgia. I work with other conditions as well, but fibromyalgia is really where I can help people the most. And also co-founded a nonprofit for fibromyalgia and chronic fatigue syndrome. And so we do a lot of things, like BJ was talking about, with trying to get Medicaid to cover fibromyalgia. Right now, we're the only state where fibromyalgia treatment is not covered for people who are on Medicaid, who are on the Oregon Health Plan. So we're working on that. But fibromyalgia is one of those conditions that's very difficult to diagnose and to treat, because for one thing, we don't really know what causes it. We don't really know what the mechanism is in the body. It's only just in the last 6 months or so that there's even a blood test that you can take to find out if you have it. Before that, it was almost a process of elimination. So there's a lot of exciting things, and being in Portland is a great place to be for that. We've got a lot of really great researchers here, and yeah.
Thank you, Tammy, for being here as well. And our last panelist, and we always save the best for last, is Anita Noble, who, in addition to being just an incredibly articulate and fantastic voice, who's always there to volunteer to help me whenever I need someone to speak on behalf of patients, is herself just a great resource. So Anita, if you would tell us a little bit about the work you do with Molly's Fund, and feel free to give a plug.
BJ, you sure put the pressure on me. My goodness. Can I live up to it? Well, you've heard all about lupus. I want to tell you how to live with lupus. I like to say, yes, I have lupus, but lupus does not have me. I was diagnosed over 18 years ago by a dermatologist because I had the cutaneous lupus, which did become systemic lupus. For me, the organ that lupus chose to attack is my lungs. I cannot stress strongly enough for you to be your best advocate with your physician. You are the client, you are the patient, you're the consumer. They work for you. If you're not happy, you find somebody who listens to you. We as lupus patients, or anyone with an immune illness, we have all kinds of ologists in our world. We have an ophthalmologist, gastroenterologist, dermatologist, rheumatologist, and the list goes on and on. Pulmonologist for me. Twice a year I have to take a lung function test, CAT scans, to just keep an eye on how the inflammation in my lungs are going. And Dr. I'm going to make sure I get this right, Lewis, we have lupus fog. He is so right. I travel a lot because my grandchildren, and I do carry in my wallet my medication list. I've moved to several states. I carry the paperwork. I ask for all my records. And we all know, as patients, the list goes on and on and on. And yes, that was my question about, what if I just stopped taking them? What if I take them every other day? Would that work? And he said, please don't. So, the eye drops from the Plaquenil, because my ophthalmologist does the visual field test. My eye appointments are like medical appointments so that the insurance pays for them. Don't have them put them down as vision or eye checks. Have them make them a part of your wellness checkup. And you should have physicians that talk to each other. I have one who's given me his cell phone number because I see him so often. And I'm sure all of you have heard that we as lupus patients are the last person they want to see in an ER room, because they never know what organ is going to fail on us first. And so I'm just here to tell you that at soon to be 61 next month, I'm living my best life. I take each day as it comes, one foot in front of the other. I thank my parents for my genes, but in my family, I have lupus on my mother's side, my father's side. I have first cousins that did not see their 50th birthday. I have a son with Kikuchi Fujimoto, another autoimmune. And, there are, the doctor was right. We have to be our best cheerleader. And if any of you who are here today are not a part of a support group, I can't strongly encourage you enough to look us up. Check out Molly's Fund. We have an online support group twice a week with great facilitators. We have an in-person support group every second Saturday of the month at 11 a.m. And it is important, because physicians will try and make you go, well, when I was first having problems and I was in New Jersey, well, how's your marriage? Are you unhappy? I go, my body doesn't like me. It's working against me. It hurts. I am in pain. Well, none of the tests show anything. I'm like, okay, maybe I am unhappy. Maybe, I don't know. So it's important that you be aggressive. I can't say that enough. And we know our bodies better than anyone else.
Mm-hmm.
So if you're not happy with the physician, you find somebody that hears you, respects you, and takes the time to listen to you. And at Molly's Fund, we're doing some exciting things. You're going to hear about Molly's Fund in years to come because we're about educating, advocating, and supporting people, and we want to collaborate with all of you and the city of Portland and the community. So I thank you for your time. Was that okay, BJ?
Anita, that was great. Thank you.
Want to make sure.
And I didn't realize we were allowed to bring props, so.
Oh, yes.
So I'm going to share my grand evil plan with all of you here, and feel free to spread it. HIV patients created the modern patient movement because nothing existed and doctors were the gods and we did as they said. And my goal, and the goal of 1 in 4, and in working with Molly's Fund, is to teach everybody else what we've learned so that you are all able to learn how to be patient advocates for yourself. We've talked about the role of provider in this, and something else I want to add is the role of the pharmacist in this. If you are fortunate enough to see or use a specialty pharmacy, it is critical. They are able to work magic. They are able to get medications covered. They know the language to use for prior authorizations. And if you're seeing a number of doctors, it is so important for your health to have one person who knows all the medications that you're taking to be able to look at any potential interactions or problems. We talked a little bit about Medicaid, and I wanted to speak a little bit about the Affordable Care Act and how we've done so well here in Oregon with Cover Oregon. I knew that would get a big laugh. So this is policy, so this is nonpartisan. Here are the numbers. In Oregon, we've enrolled 271,000 people in insurance that have never had insurance before. That's really good. Nationwide, it's more than 8 million. 77,000 are on private insurance, and 193 are expanded Medicaid. And the reason that this is important is that all of these 271,000 people now have access to preventative care and service, an annual wellness exam where you are able to ask your doctor and to find out and be screened for chronic conditions. The best way that we can treat chronic conditions is to prevent them. Other than that, it's to diagnose them early and get patients linked to care as soon as possible. It's just critical. Some other quick things about how the Affordable Care Act has helped us. We've eliminated the cap. It used to be patients had a cap of roughly $1 million that once that was paid for or once that was reached, your care was no longer covered. We've also eliminated the prior, I'm spacing on my notes here, excuse me. Pre-existing condition, thank you. And we've given mental health equal parity. And this is all important because many people living with chronic conditions are also living with chronic mental health issues. And it's about time that we treat mental health issues at the same level that we treat other chronic physical conditions. Dr. Thomas mentioned the HPV vaccination. Well, HPV vaccination is now covered under the Affordable Care Act. It's covered for boys and girls, which is absolutely incredible. And the other thing is patient assistance plans. I've been having these kind of quiet conversations throughout the day. Can I see a show of hands? Who's aware of patient assistance plans? Fantastic. These are plans that are done by pharmaceutical companies that will help to pay all or some of the costs of medications. Now, here's the good news. You can use these plans with Medicaid, Medicare, and certain private insurance. And the best person to figure this out is your pharmacist, because your pharmacist knows how to do this. And these can be fantastic, because one of the things that we've seen with everyone being covered for medications is that you have coverage, but instead of having a standard copay, you're now facing a co-insurance. And so you're paying more out of pocket for medications. And this is where these copay programs can come in place and really help. That's kind of all I had to say, but I was hoping that we'd be able to have a conversation and some questions from the audience about what some of your concerns are. And I'm happy to foster that. I mean, we had talked a little bit about medical marijuana earlier, and Oregon is one of the states where you are allowed to use medical marijuana. There is a lot of research that still needs to be done on the efficacy and safety of medical marijuana, but there's also a lot we know. And Dr. Thomas and I were talking earlier during the break, and there are very many other ways other than smoking that you can use medical marijuana: tinctures, creams, edibles, and these do provide assistance in pain, relief, anxiety, and symptom relief for a great number of patients. And it's important to note that we're one of the states that allows you to do this.
And with that, BJ, for me, I've spoken to 3 of my physicians regarding medical marijuana. I spoke to my ophthalmologist about it regarding my glaucoma, and she said, yes, there are benefits from it. My rheumatologist said it, would, help in your pain. The physician who introduced me to it was my primary care physician, because at the time I was losing weight. I just couldn't gain weight. I had no desire to eat. So she's the first person that suggested it to me, but she told me to run it by everyone. And as my lung doctor said, whatever you do, you can't inhale it. And I said, yes, I understand that. And so he said, there's the tinctures, there's edible. So, it's something I haven't tried yet, but, to know that 3 of my physicians all, discussed the benefits of it, it made me feel better.
So this is an example of how patient advocacy interacts with policy. So we know that this is something that patients can benefit from, certain patients under medical conditions and under supervision. However, here in Oregon, the Oregon Medical Board is currently screening any patient who takes a narcotic pain medication for marijuana before they will continue prescribing new pain medication. And this is problematic because this violates Oregon law. So this is one of those areas. The other one, and Tammy spoke to this, and I know that this is definitely a case in lupus patients, is getting Social Security disability. Yeah, I see both of you. Good.
It's something that I do talk to people about. The National Scleroderma Foundation puts on national conferences every year, and we take these classes, and I always go to the depression classes and the disability. And it's surprising how many people don't give enough information. And that is one of the key factors on whether or not you can get your disability the first time around, or have to wait a year, 350 some odd days, before you can go back and, try this again. It is all about information cooperation from your doctors, getting your own medical records so that you can fill in any gaps that your doctors leave out, so that you know what they're talking about, so that you understand that they're giving a clear picture of what all your conditions, and what sometimes the fact that you might be able to work an 8-hour day, but what does that do to you the next day? Sometimes we answer in the simplest forms, but it's not the information they're looking for. So one of the things I always say, of course, is never lie, but explain, 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 and give the consequences of everything you do, because it matters on whether or not you get accepted that first time around.
I think one of the things that we all face living with chronic conditions is, we are strong, independent people, and there are times that we need help. And it is very humbling and very difficult to have to ask for help. But to recognize that Social Security disability this is a program that you've been paying into your entire working life. And it's not something that you have to be on forever. But if it's something that you need to be there and it's going to help you make ends meet so you can focus on your health, then this is what it's there for.
And another thing that I didn't realize, as I told you my story, I filed when I was sick, but by the time I saw a judge, I was better. I did not know at the time that if that happens, you can still file for a specific period of time when you were sick. I talked to so many people who are afraid of starting the process because I'm going to get better. That's okay. Start the process anyway, and you can still file for, however long it was that you really were sick. And that's something I wish I knew.
And Liz is right. I filed, and I was awarded. But document, document, document. Make sure you have a good relationship, again, with your physician, because they need to know how to answer their portion of the questions, because they're asked questions too about you. So not only do you need to, as Liz said, yes, I can lift this amount of weight or I can sit this long, but 3 days later, or if I do this, if I do A, B, and C, D is going to happen. And be on the same page with your physician so that they can, collaborate what you said, because that is important. And you're right, you can go back, and when you do get the award, it starts from the date that you entered it in, because I was employed at the women's prison here, a correctional facility, and they don't have the best health care there. And I was encouraged by my physicians, because of my immune system, to go, what you're doing, being around, that unhealthy population is not good for you. And just the amount of stress that I had with the job. So, that's what made me start the process. I mean, did I want to stop working at 56? No, I really didn't.
Right.
But, when you have the lupus flares and you're having biopsies, and for me with the lungs and shingles, and it's like, wait a minute, I've been working since I was 16 years old. I've earned this.
And that is something we have to remember about disability. If you've put your 20 quarters in, you have earned the right to have disability. It's how you go about the process that makes a difference on whether or not you are awarded that disability. You have to be able to, and the doctors have to verify that you will not be able to work for the next 12 months. It's not as simple as, well, I can't work for the next few weeks. That's not what they're about. It is about the next 12 months of your life. Can you work or can you not? Can you make X number of dollars a month or not? And I have to say, just a side story, when I went in and applied for disability, I think I was diagnosed in a February time zone, and I continued to work until July, and at that point I could not. My hands were so swollen. I could not pick up a pen. I could not write. I could not do anything. My husband was cutting my meat. He was helping to dress me. I took my clothes in. I had all the buttons replaced with Velcro underneath, so it looked like buttons and zippers in my pants, but all I had to do was pull, because I simply could not do these things. I was in that kind of pain, and my hands were that big. At that time, I simply went into the disability office because I was really dumb. I didn't know what the rules were. I just went in and applied. But I said, completely off the top of my head, I think I need someone to help me with the application because I can't hang on to a pencil. And I think bit by bit, all the little mistakes or odd things that happened to me had taught me what to share with others, how to help them. And then I started taking these classes on the disability and found out so much more. But really, it comes down to information. The more information you give, the more you have in photographs or visual information. If you have, problems with your hands, if they're swollen, if they're, and it's difficult when you have a fibromyalgia, something that you cannot. I know my sister has fibromyalgia in all 18 points. So it's difficult when you cannot see. But if there's anything visual that you can take with you, photograph, put into that file, besides what the doctor has, do it. If you submit it, it has to go into your file. So.
I thank you for sharing your story. And for me, it seems like a simple logic puzzle is that if you were once able to pick up a pencil to fill in a form and you can't do that now, then de facto, you are not the same person that you were in the past. What are some of the challenges that you all find in being able to not just provide for yourself, but provide for the people that you do help provide services for? And things, for example, are you having difficulty finding specialty providers? Are you having difficulty getting payment for specialty providers? Things of that nature.
I can tell you a few. One of the biggest challenges we have in our support group helping people with fibromyalgia and ME/CFS is finding MDs that can help. Back to the Social Security disability issue, they will only accept testimony from an MD or an osteopath. So one of the most effective things that I find is seeing a naturopath, but that doesn't count. And it's also not covered for a lot of people. So finding MDs who really understand the disease and can help people feel better, that's one of my biggest challenges. I was lucky, but most of our support group members are not. Do you have a doctor's list? I do. You can talk to me afterwards about that.
And this would be a good time to say, if anybody in the audience has questions, you have the cards in front of you, please write them down and just hold them up, and we'll be happy to answer as many as we can, and we'll also be here for a little while afterwards.
So yeah, that doctor thing, the studies have shown that the average fibromyalgia patient will see 5 or more doctors and go 5 or more years. So that's why I make it a real priority to have a list of doctors so that I can maybe help shorten that time period.
And that's the average lupus patient is 4.5 years?
About 4 or 5. And if any of you have ever heard, Molly's story, I believe she saw over 14 physicians before she was finally diagnosed. And like I say, I was living back east when, I knew something was wrong, but it took a dermatologist in Indianapolis to say, yes, you have lupus. And I had people ask me, I guess as a child, my mother said I would spike a temperature for no apparent reason, and as quickly as it came on, it would leave. And then once I, finally started, having doctors who would listen to me, I had one physician said, well, you should go, when you go home to Portland again, have a bone marrow test. So I did. I went and saw a hematologist who gave me a bone marrow test, and it came back damaged. And he wanted to know, had I ever lived out of the country? Did I live in a poor rural area with, power lines? Because, not only that, an eye doctor said, you've got a lot of scarring on your retina. And they were saying, well, maybe when you get older, you're going to have multiple sclerosis because something's not right in your system. Well, what it was lupus. But it takes a while. It's a search. It's, it's going on a hunt. Not a good treasury hunt, but a hunt nonetheless.
One of the reasons that we pay so much attention to what happens in Medicaid is at each state, what happens in Medicaid sets the baseline, or what we call now the bronze standard for private insurance plans. And this not only impacts Medicaid, but it impacts government employee workers and pension workers as well. So this is one of the reasons that we pay pay so much attention to having treatments and medications covered by Medicaid is because we see how this impacts just across the spectrum. I'm curious as to what takeaway piece of advice that you'd like to share with people.
It's very odd. I had a cleaning at my a dental cleaning this morning, and I had something that said scleroderma with me, and my dental hygienist said, "What is scleroderma?" I explained it to her, and she said, "It's an autoimmune." She said, "My sister just had a kidney transplant 2 weeks ago, and she has lupus." And so I gave her Molly's fun.org information right away and told her, please get in contact with these people whenever she is able to come out and be around safely out in the environment again. But the one thing I said, make sure that you are positive for her. It is hard because depression is there, and every day we have to get up and make a decision that this is the best day of our life, because it is all we have is the now. We can make plans for a future that may or may not happen. When I was diagnosed, I was given a pamphlet, and I think it was from the RA Association 21 years ago. I've been a patient 21 years. And it was about scleroderma, and it said, well, you have, from the time of diagnosis to the time of the end of your life, 8 years. That's it. And I thought, oh, great. Well, I don't worry about tomorrow, but, in a few months, I might want to start talking to my family and making some plans. I went a couple months or so after that to my first support group meeting and met 2 women who had been living with scleroderma over 20 years. Like, what is that? What I've learned along the way is don't believe everything and live the best that you can that day, because every day is different. Your pain level's different, your depression level is different, your challenges for the day are different. All you have is that day. Decide every day, that is the best day I can have.
I have a friend who said, if you don't have any hope, borrow someone else's. And I think that's kind of what you're talking about. There's a lot of us who have been able to get better and live a good life, and surround yourself with those stories. For me, the biggest thing in my getting better was learning how to take care of myself. I was one of those people who, burned the candle at 15 ends, and treated my body as if it was a mule. I just had to whip it to get it to do what I wanted it to do, and I don't have that luxury anymore. I had to learn how to take care of myself, get a good night's sleep, take my medications when I'm supposed to, and all of those things. And that is the primary thing that I focus on with my clients. A lot of times people will come to me and say exactly what Anita said. Can I get by without taking these every day? And I think we all have to find our own reasons for why we do what we do. We have to understand what the treatments are doing for us. If you're just taking a medication, you don't know why you're taking it or how it's helping you, then I think it's a lot harder to do that. So, learning as much as you can about your illness, learning how to take care of yourself, what does good sleep look like, how to say no. Do these things sound familiar? You've already heard them once today. But that is really, if I can tell you anything, that's it. Learn how to take care of yourself the way that you would take care of a friend. Take a look at your life and think about it. If this was my best friend who was doing these things, what would I say? Would I encourage her to make some changes? Would I support what she's doing? Those kinds of things. And if you don't make yourself a priority and take care of yourself, then how can you expect the people around you to honor that? If you say I need to go to bed on time and then you don't, I'm totally guilty of this one, then how can I expect my husband to not look at me and say, oh, can we just watch one more show, just stay up a little bit later? I've taught him that's okay. So think about how you take care of yourself, because you are teaching the people around you how to take care of yourself. So
I'd like to see a show of hands of who's here with lupus. Wow. And how many of you are newly diagnosed, like in the last year? Okay, all right. How many of you are part of a support group? Good, good. And for any of you who may not be a part of a support group, I strongly encourage you, if you're comfortable, to leave your name and number with us so that we can, become your second family. What I want to say is, find an advocate. Sometimes when you're sick and you have to go to a doctor, I've gone with Molly's mom sometimes because I can't speak for myself because I'm so depressed or in pain that I can't articulate to the doctor what's wrong with me. So find somebody who can be your voice when you can't be your own voice. Discover your new normal, because when you're diagnosed with a chronic illness,
Exactly.
you have a new normal. You need to find out what yours is, what your limitations are now, what works for you. Because for many of us, you look great, you sound great. What do you mean you're sick? You don't look sick. What does sick look like? But discover your new normal. And like Tammy just said, embrace yourself. That's my motto for 2014. Embrace yourself. I'm embracing me. Dr. Thomas was right. Stress does kill. It does. And I've been through some very trying times these last few years, and I've just decided, oh no, it's about Anita in 2014 and 2015. So embrace yourself. Find your new normal. And that's what I would leave with you.
Well, thank you. And I just want to come back to one question, which is, we've all sort of skirted around the issue of mental health and depression. We talk about the importance of support group, of having an advocate. What can we do to better understand the difference between I'm having a crappy day, I'm having a couple of crappy days, and what is really depression, and to seek treatment for depression? And by treatment, I don't necessarily mean pharmaceutical. It could be talk therapy, it could be a dog, it could be whatever works for you. But how can we help to move people more in that, to have this conversation openly and honestly?
What I have compared lupus to is death. And we all know about the 7 stages of grieving. You go through anger, why me? Denial, what did I do to cause this? So, be honest with yourself. Be honest with yourself. And I know over the years, I've gone to counseling. I've talked to therapists about how I'm feeling, because sometimes we need things validated. We have to know it's not in my head, this is real. And at times like that, you have to respect it. So, look at those 7 stages of grief. And like I say, when you're diagnosed with a chronic illness that really affects everything, and then, the statistics tell us that some of these are fatal. In our support group, we have people as young as 11 all the way up to, their 60s. So, I guess, BJ, it's real.
Mm-hmm.
Know that it's real.
Yeah.
Your feelings are real. Validate those. And don't, don't try and keep it all to yourself, because like you said, we're strong people.
Right.
I can handle this. I can do this. Sometimes we have to admit, no, I can't. I surrender.
Yeah, and I think that's one of the things that's most important about finding support networks and support groups is just to realize that you don't have to go this alone. Tammy, what do you think?
Well, I was actually diagnosed with depression before I was diagnosed with fibromyalgia, so I totally get this one. For me, it's been really helpful to learn what my warning signs are. One of the biggest ones for me is when I notice I start sleeping a little longer than I usually do, or I'm not motivated to do things that I would normally want to do or like to do. For me, those are my early warning signs. And I know that that's, okay, there's something more going on than just I had a bad day. So, start paying attention, learn yourself, and start paying attention to what those things are. And don't be afraid to ask for help. There can be real biological, biochemical reasons for depression. Sometimes, I think that sometimes it's not a huge mystery. It's like your body isn't doing what you want it to do, and that's depressing. Don't be afraid to ask for help, to get some more information, to find some answers. It's not necessarily something that you have to live with. It may be a separate thing aside from, what your main illness is, whether it's fibromyalgia or lupus or whatever. That there can be real reasons that can be treated, so you don't have to suffer.
This is going to sound very odd, but I don't suffer from depression and never have. So I, 40 years ago, changed my inner voice to positives and left the negatives behind, and I've learned how to do that, and I don't suffer from a depression. However, having said that, I live with a man who is and does suffer from a form of depression that's, they say, is genetic. That's been handed down, and all of his family seems to unfortunately have this depression, and it is the most difficult thing, I think, of any condition that you have. He was diagnosed with Tourette's at 44, completely unheard of, but the chemical depression that he has within his brain started long before that, and I think that is the hardest fight a person must have with any condition, is to
especially if
battle
you're
that.
living with an autoimmune condition, on top of it, you have all of these invisible,
Yes.
from the standpoint of the outside observer, these invisible conditions that you have to battle with. But just the takeaway from me is the ability to, in your capacity and what you've been able to do in neurochemical change, or neuropositive thinking and changing your thinking, being part of support groups. I know one of the things that is very helpful for me and has been helpful for me is being able to give back to the community and just to give back to other people. I'd love to hear your thoughts on that. And and keep in mind the fact that y'all are sitting up on a table today on a Saturday afternoon. You all look very nice. You took the time to get here and make yourselves look nice and to prepare for this, so you are already giving back. How do you feel? What are your thoughts about this? How does this help people? How does this help you? And what can we do to encourage this in others?
For me, it's really easy. I figured that if I went through pain, helping somebody else maybe avoid some of it makes my pain worth it. Everything that I've learned, everything I'm diagnosed with, I actually think, oh, yay, this is something else I can help my clients with. I was diagnosed with a sleeping disorder a couple years ago and have to use a CPAP machine. It's like, okay, yay, now I can tell them what it's really like, But those are things that I know because I went through it, And so for me, it's just, if I can take my lemons and turn them into lemonade, it makes everything I went through worth it. So for me, that's an easy question.
Anita, what about you?
I like to stay busy.
Uh-huh.
Sometimes maybe to a fault, but I enjoy giving back. I've always given back. I volunteer with a lot of organizations. If you look at the bio, I've always been involved with at-risk youth, working in lockup facilities in Indiana, being in the women's prison here in Oregon, doing ride-alongs with the Portland police, and so no, that I think when you have a chronic illness, you have to find some other kind of outlet. I think that's important. And maybe it's your family, maybe it's a loved one, maybe it's a child. There's nothing like little people to put a smile on your face. So, I think that helps, having some other outlet other than the many doctor appointments we go to?
I sing with 2 choruses, and I think that has kept me healthy within, you know, in so many ways, because I'm interacting with people all the time. I've been on 5 board of directors as a volunteer, helping others going in whatever direction they choose to go. I've been with the scleroderma support group for 21 years, doing that. Worked on their board of directors for almost 17 years, I think. We do educational things for our people. We do a walk. We have a walk coming up in July. There's just so many ways when you are helping and talking to others or giving your time to others, you don't have time to dwell on whatever your problems are. And I think that is, like Anita said, I'm a busy person. Everybody, when people say, you know, I'm going to retire soon, I don't know what I'm going to do with myself, it's like, oh, I don't have time to work. You know, it's like I've got so much on my plate, and I love that because I'm not dwelling on the fact that my hands are deformed. I'm not dwelling on the fact that my digestive system is just gone, you know, to hell in a handbasket. Can I say that?
Sure.
You know, or these things. When people call the Scleroderma Foundation and talk to me, sometimes I'm the first person they've ever talked to with scleroderma, and they get so excited in my ear that I have to hold the phone away. It's like, I've never talked to anyone with scleroderma. I'm talking to someone and they're yelling at their family. I'm talking to someone with scleroderma. You know, it's like just the fact that you give a little to somebody is a huge payback.
Well, you're listening to someone and you're there for them, but the other part of that is that when a patient finally understands that there is an actual physical condition and it's not a psychosomatic condition, it is just so very validating to have that answer, even if there's not a treatment or a cure in sight. It's just, this makes it real, this makes it tangible.
When I walked into that first support group 21 years ago and found 2 women that were running the group that had scleroderma over 20 years, it was like instant hope and realization that maybe not everything in print is true, but here I am 21 years later, and the lady that was Donna Stone that heads the support group 21 years ago when I went in, is still heading that support group, and she's had scleroderma for at least 40 years now. I mean, the fact that she walks in and smiles at everybody, and she's going through more than I am, she can be pleasant and welcoming to everybody. It embraces everybody that walks to that room. It's like, well, where would I go? Where else would I go but to follow those footsteps? I mean, you know, it means so much to somebody else when you can extend a hand and say, I can't help you, but I can listen, or I can understand some of what you're going through.
It's empathy.
You know?
And BJ, we have an event coming up next month, Butterflies in the Park at Oaks Park for Molly's Fund. And just running, you know, walking in that, doing the online support groups and hearing from people all over the world, I mean, it puts a smile on your face. And if I'm blessed enough to be here, I will be doing support groups at age 80.
Right.
In 20 years, I plan to be a part of Molly's Fund. You know, I plan to still be saying to people, hey, it'll get better. You know, I'm here. You know, it's another day. I like to tell the women and the men, we have men in our support group. You know, and we have a couple of them here today. I like to say, and it might be sexist, but I'd like to tell them, I could have been born in a third world country told to walk 10 feet behind a man. What have I got to complain about?
Right.
You know, it's all relative. Somebody somewhere is going through something.
That's right. I can cut my own meat now. You know.
Congratulations.
Yeah.
Well, I want to thank our panelists, and this has been a really remarkable thing. We've been fortunate enough working with Molly's Fund to do a number of innovative programs, and I'm really proud of the work that we do, and I'm so proud of the partnership that we have with Molly's Fund. And I'm going to embarrass my board members and ask them to stand. If I could please have Debbie McCabe, Diane Danowski-Smith, Kayla Victor, and David Chaplinsky stand. And these are the people who have been so critical to the success of 1 and 4 and my ability and our ability to do this. So we will be here if you have any questions. Thank you very much. And here's Tracy.
It's so great to have all of you together and to bring the whole community together of autoimmune diseases and to celebrate Lupus Awareness Day. So, I'm sure some of the panelists are going to stick around if you have other questions, or you can feel free to email us and we'll pass them along as well. So now, if anyone, also, OMSI is open for another half an hour until 5:30. So if you do want to go look around, you can just tell them at the front desk that you are with us at this event, and you will get free admission. So feel free to do that. And also, we will be continuing our Lupus Awareness Day celebration at 5:30 today. We will be playing our video that we just made at Molly's Fund to celebrate Lupus Awareness Day and show all of our programs and everything going on. So we invite you to join us to that. So thank you all for coming.